Assalamualaikum warahmatullahi wabarakatuh. My name is Ardina Lukita Riyanto and my BP number is 2010733016. So in these occasions, in these presentations, I would like to explain about the dark of anxiety. So there is 5 content that I will explain about my title, The Dark of Anxiety. There are what is anxiety, types of anxiety, symptoms of anxiety, what cause of anxiety, and the last one is effects of anxiety. So the first one I will explain about is what is anxiety itself. So anxiety is a feeling of fear, dread, and uneasiness. So it might cause you to feel sweat, feel restless and tense, and have a rapid heartbeat. It can be a normal reaction to stress. For example, you might feel anxious when faced with a difficult problem at work, before taking a test, or before making an important decision. So the anxiety may give you a boost of energy or help you to focus. But for people with anxiety disorder, the fear is not temporary and can be overwhelming. So, for example, going to a job interview or giving a speech on the first day of school, it may cause some people to feel fearful and nervous. But if you're feeling of anxiety are extreme, last for at least 6 months, and are interfering with your life, you may have an anxiety disorder. So, what is anxiety disorder? So, it is normal to feel anxious about moving to a new place, starting a new job, or taking a test. This type of anxiety is unpleasant, but it may motivate you to work harder and do a better job. Ordinary anxiety is a feeling that comes and goes but doesn't interfere with your everyday life. So, in the case of anxiety disorder, the feeling of fear may be with you all the times and intense, sometimes debilitating. This type of anxiety may cause you to stop doing things you enjoy. For example, it may prevent you from entering an elevator, crossing the street, or even leaving your home in extreme cases. If left untreated, the anxiety will keep getting worse. Anxiety disorder are the most common form of emotional disorder and can affect anyone. But according to the American Psychiatric Associations, women are more likely than men to receive a diagnosis of anxiety disorder. Next is about types of anxiety. The first one is generalized anxiety disorder, or GAD. It is about a person when feels anxious on most days, worrying about lots of different things over a period of 6 months or more, maybe. Number two is social anxiety. So social anxiety is a person has an intense fear of being critic, critics, embarrassed, or humiliated, even in everyday situations, such as speaking public, eating in a public, being assertive at work, or making a small talk. Number three is specific phobias. It is a person when a person feels very fearful about a particular object or situation and may go to great lengths to avoid it. For example, having an injection or traveling on a plane. There are many different types of phobias. Next, number four is panic disorder. So panic disorder is when a person has panic attacks, which are intense, overwhelming, and often uncontrolled feelings of anxiety combined with a range of physical symptoms. So when someone having a panic attack may experience shortness of breath, chest pain, dizziness, and excessive perspirations. Sometimes people experiencing a panic attack think that they are having a heart attack or are about to die. If a person have a recurrent panic attacks or persistently fears having one for more than a month, they said to have a panic disorder. Next one, number 5, is obsessive compulsive disorder, or OCD. Is a person has ongoing unwanted or intrusive thoughts and fears that cause anxiety. Although the person may acknowledge these thoughts as silly, they often try to relieve their anxiety by carrying out certain behaviors or rituals. For example, a fear of germs and contaminations. It can lead to constant washing of hands and clothes. The last one is post-traumatic stress disorder, or PSTD. This can happen after a person experiences a traumatic event, for example, war, assault, accidents, or disaster. System can include difficulty relaxing, upsetting dreams, or flashback of the event, and avoidance of anything related to the event. So PTSD is diagnosed when a person has symptoms for at least a month. That is the types of anxiety. The next one, I will explain about the symptoms of anxiety. So there are 12 symptoms of anxiety. The first one is feeling nervous, restless, or tense. Number 2 is having a sense of impending danger, panic, or dawn. Number 3 is having an increased heart rate. Number 4 is breathing rapidly. Number 5 is sweating. 6 is trembling. Number 7 is feeling weak or tired. Number 8 is trouble concentrating or thinking about anything other than present worry. Number 9 is having trouble sleeping. Number 10 is experiencing gastrointestinal problems. Number 11, having difficulty controlling worry. And the last one is having the urge to avoid things that trigger anxiety. That is the symptoms. Next is what cause of anxiety. So anxiety condition isn't developed or caused by a single factor, but a combination of things. A number of other factors play a role, including personality factors, difficult life experience, and physical health. So, what cause of anxiety? There is a lot of causing of anxiety. The first one I will explain is trauma. So, children who endured abuse or trauma or witnessed traumatic event are at higher risk of developing of anxiety disorder at some time point of in life. Adults who experience a traumatic event also can develop anxiety disorder. Number 2 is stress due to an illness. Having a health condition or a serious illness can cause a significant worry about issues such as your treatment and your future. Number 3 is stress built up. So a big event or a build up of smaller stressful life situations may trigger excessive anxiety. For example, that in the family, work stress, or ongoing worry about finance. Number 4 is personality. So people with a certain personality types are stressful life um, uh, more prone to anxiety disorder than others are. Number 5 is other mental health disorders. So people with other mental health disorders such as depressions often also have an anxiety disorder. Number 6 is having blood related and anxiety disorder. So it is about anxiety disorder can run in your families. The last one is drugs and or alcohol. Drug or alcohol use or misuse or withdrawal can cause or worsen an anxiety. The last one I will explain about effect of anxiety. The first one is respiratory problems. So when a person is anxious, his or her breathing becomes short, shallow, and rapid. So this leads to unhealthy breathing patterns when the amount of oxygen inhaled is more than the amount of carbon dioxide exhaled by the person. Excess of carbon dioxide exhaled by the person um, excess of carbon dioxide can restrict the blood supply to the brains. So it is leading to dizziness, tingling of numbness in the hands or feet, or loss of consciousness. Anxiety can also worsen the symptoms of asthma conditions. Patients suffering from inflamed airways or chronic obstructive pulmonary disease may also need frequent hospitalization due to stress. Number two is gastrointestinal disorders. Anxiety and constant worry can lead to chronic digestions and excretory problems such as stomach pains, excessive bloating, and or abdominal cramping, diarrhea, irritable bowel syndrome, vomiting, and so on. Number three is immune system. Frequent stress hormones and coping with the fight or flight response may not allow your body to return to its normal rested state, so leaving your immune system vulnerable to illness and viral infections. During this time, regular flu jabs and vaccinations may also not work for you. Next one, number four, is heart disease. So heart palpitations and rapid breathing patterns are commonly experienced during a bout of anxiety. The persistent rush of stress uh, respond hormones at persistent high levels, high levels of anxiety may cause high blood pressures and coronary problems such as heart disease or heart attack. Number five is muscle tensions and chronic pain. Frequent distress signal from your amygdala to your central nervous system to prepare for a stress response can cause your muscle to contract or tighten very often. So constant muscle tension can lead to cramped, stiff, or sore muscles and aches and patience and can tend to spread throughout the body. These may result in chronic pain conditions such as joint pains, fibromyalgia, fibromyalgia, and so on. The next one, number six, is memory loss. So if you are constant worrier or suffer from generalized anxiety disorder, it may also impact your short-term or working memory as a consequence. You may find yourself making frequent mistakes, forget important appointments, and unable to cope with hectic schedules. So when this happens regularly, it is difficult to take important decisions at work or at home. Performance at school or office environments may be severely compromised. This leads you to be more anxious and enter into a state of depression. The last one is weight gain. When you get anxious repeatedly, your brain floods your body hormones of adrenaline and cortisol. These high probably influence you to reach out for sweet comfort foods like chocolate, creamy pastries or cake, and arid drinks that contain a lot of sugar. However, the rise and subsequent drop in your blood sugar levels lead to an instant craving for salty and sugary food again. This unending roller coaster of persistently anxiety levels can lead to weight gain and obsessity. So anxiety and depressions are two different states of energy, is high and low, that are connected by a common cycle of fear, feeling of helplessness, loss of control in routine activities, and frustrations or dejections. So the constant fear of letting oneself down can push a person to be anxious again. Untreated anxiety disorders can easily lead to a state of depression. However, anxiety can be overcome using therapy with love and family support, meditations, and many other techniques. Do speak to your doctor as early as possible if you are connected. Well, that is my explanations about the dark anxiety. Thank you very much for your attention. Assalamualaikum warahmatullahi wabarakatuh.